So I think now we're going to do some closing remarks from the three of us, and Dave is going to start.
Okay, we're done.
Whoa!
No, this has just been. I don't know what to say. It's just been an amazing 2 days. Like I think every year this conference gets better and better, and I feel healed after 2 days of being here with everyone, and I feel cared for, and but also I feel like we got a lot of work to do. Thousands of, maybe that's an exaggeration, hundreds and hundreds of ideas have been generated in these 2 days. Hundreds of ideas. And the difference between this meeting and other meetings is we're going to do something about them, right? I mean, I think, we saw on the first day where our working groups are taking these, thoughts and ideas and moving them forward. And that's, I think, the beauty of and the power of what we can do together. For me, hearing the young people with their presentations, studying all sorts of things, it's just absolutely amazing. And so, as I said yesterday, the future is really bright, and we're going to clean up the climate, and we're going to do a whole bunch of things, but we're going to get back to the core of being able to assure that people in Africa and the diaspora of African descent can have mental health care, and not just mental health care, excellent mental health care. And that's what this is all about, and that our end game is that, and it's going to be, you have those maps, and you got green, orange, red. Green is good. It's going to be all green, whole continent. So, thank you. We look forward to seeing you at the reception, which is about a 5-minute walk from here. But the conversations will continue. Thank you very much.
I also just want to say thank you and echo what Bonga and Dave said. Every year it gets better and better, and it's wonderful always being in community with everyone here. And I think across all talks and the themes was how do we center people and humanize people and be with them through their journey of mental health and mental illness. And loved all the speakers. I think that, like Dave said, it feels good to be in a setting like this, and we have different conference experiences along the way, probably as psychiatrists and mental health professionals in general, but this always feels quantitatively different. I'm going to do a couple of housekeeping things before we wrap up. That feels like my role between the three of us. We'll leave that there for y'all to marinate on. So there's a survey that will go out next week, tomorrow, because tomorrow is Monday already. So there's going to be a post-conference survey. Please fill that out. It helps guide what we do each year for this particular conference. And so please, please, please complete that. We really take what you say to heart. I want to just acknowledge a lot of people that put this conference together, but specifically, there's page 39 acknowledges the full conference committee. A few of us are in the room, but I also just want to make sure we shout out to Sanait and Site for all of their hard work. Bonga last night mentioned Dr. Reddy, BMC, the National Research Foundation. All three of those organizations really helped put all the conference materials together, the dinner, the food, everything that you've seen over the last 2 days. And so we just want to acknowledge that. Kids Positive is the the beads that you have for your name tag. And so they're a local organization that we've used every year, I think, so far for this. And so it's really nice to give back in that way. I mentioned Talia, she had to leave, but you'll be getting copies of all her sketches and that concise summary visually of what happened. And so we'll be sending that out as well. And then last but not least, I think I started with this and I'm going to end with this. Don't forget about AGMHI membership and the QR code, which is on the last page of your booklet. And so you'll probably get tired of me saying that, but this is the last time I'm saying it. And like Dave said, we're gonna take a picture, so don't leave right in this moment. We're gonna take a picture, but then at it's Century City's hotel, the Urban Square Terrace, where the cocktail hour will be. Okay, thank you all.
So,
There's one more thing.
Dave, Dave just reminded us that we've been meeting every year for a few years now here in Cape Town, and the committee was wondering whether we should maybe change cities next year. And there's a young man sitting in the front who's promised us an amazing African experience if we go to Nairobi. So yeah, we're going to look at logistics, but we hopefully will be hosted by Aga Khan University and Professor Lukoya Toli and all our friends and colleagues in Nairobi in November next year. There's rumors that maybe the Black Psychiatrists Association might also be going to Nairobi. So they will be going to Nairobi, and so we're going to try and see if we can pair with the BPA, which I think will be a fantastic meeting. Yeah.
And it's the transcultural conference. They usually have about 75 Black psychiatrists from the U.S. So, but the interesting thing is that who was the first president of the Black Psychiatrists of America? Chester Pierce. So it all connects.